Hello friends, let us now learn about the segmental anatomy of different. In the right lung, we have three different lobes. We have upper lobe, middle lobe, and lower lobe. And we have segments, different segments. Like upper lobe is divided into an apical segment. See like this. Upper lobe is divided into, in the right lung, we have an upper lobe, middle lobe, and lower lobe. Upper lobe is divided into an apical segment, anterior and posterior segment. Middle lobe is divided into a medial segment and lateral segment, whereas lower lobe is divided into an apical segment, medial basal segment, anterior basal segment, lateral basal segment, and posterior basal segment. So true. But what we see in X-rays, X-rays are not three-dimensional, right? They are just two-dimensional. So you will just see a flat surface. What is each segment representing? Where are they? So for that, we can use different views. And where are they? Is that many segments are superimposed over one another. So to prevent that, we have made here the Felson's textbook of chest rhonginology has given us good representation of the segmental anatomy. But remember one thing, that each person will have their own different segments. There are hundreds and thousands of variations and seen in this segmental anatomy. But the number of segments may be same, may not be same. But the gist is that each segment is supplied by its own segmental bronchus, and that bronchus can be approached through a bronchoscope, and especially there is treatment given to specified bronchus which is affected by any disease process. So if you see here, we are seeing in frontal view, we will see the right pulmonary segments, bronchopulmonary segments in frontal view, in the right posterior oblique view, and also in lateral view. So first and foremost, if you see the frontal view, in the frontal view, actually, this is the first segment. In order to prevent confusion, we have overlaid one over the other. So we have an apical segment and anterior segment. Okay, we have an apical segment. This is actually, if you see, this one is actually the apical segment of upper lobe of right lung. This two is anterior segment of upper lobe of right lung. This four is actually the lateral segment of middle lobe. This is actually the middle lobe. And lower lobe, this is posterior basal segment of lower lobe. Okay, so this is the posterior basal segment. So this will be posteriorly away, behind, and this is apical, this is anterior. Similarly, in the upper lobe, posterior to this apical and anterior, we have posterior segment of the upper lobe. So if you only take this upper lobe, apical one will be above. This 2 is anterior, so it will be present anterior located, whereas 3 is posterior, so obviously it is located posterior in position. Then we have middle lobe. In the middle lobe, we have medial, which is 5. Sorry, 4. 4 is medial. 4 is lateral. This is lateral, and this is medial. So middle lobe, we have medial, which is actually 5, and we have lateral, which is seen here. Then we have lower lobe. Lower lobe, most of it is present posteriorly behind the middle lobe. So in the lower lobe, we have superior segment, which is actually superior segment of lower lobe. Then we have medial basal segment, which is 7. This is anterior basal segment, which is 8. This is anterior basal segment. This is lateral basal segment, and this is 10th is posterior basal segment. So these are the frontal views of the right lung, frontal view of right lung. Similarly, we have right posterior oblique view. So if you see in right posterior oblique view, this is apical, this is anterior segment, and this is posterior segment of upper lobe of right lung. In the middle lobe, we have lateral segment, which is 4, and medial segment, which is 5 of middle lobe of lung. Similarly, in the lower lobe, we have superior segment. Then we have medial basal segment, which is actually not seen here. Then we have anterior basal segment, which is 8, lateral basal segment 9, and posterior basal segment, which is 10. Similarly, this is lateral view. In the lateral view, this is apical segment and anterior and posterior segments of upper lobe of right lung. We have lateral and medial segments of middle lobe of right lung. Then we have superior segment 6, 7, which is medial basal segment, anterior basal segment, then 9 lateral basal segment, and then posterior basal segment. So these are different segmental anatomies of the right lung in different views. Remembering these is not necessary. The only thing that you should remember is the division into different bronchopulmonary segments, because these bronchopulmonary segments vary from person to person. Thank you.